watching AYV Television.
From a broadcasting house here on West Street in Sierra Leone's capital, Freetown, this is Primetime News on AYV TV and radio. You're watching us on channel 33 and listening to us on frequency modulation 101.7. I am Alimata Judge. Let's start with tonight's headlines. Government of Sierra Leone and stakeholders participate in a capacity building training to enhance national security. UNICEF delegation targets child marriage hotspots in a move to end the practice. And also on Primetime News tonight, Gold Sierra Leone officially launches its mentorship program to lower maternal mortality rates. Hello and welcome from wherever you're watching me. I am Alimata Judge. First in the news. Sierra Leone is advancing efforts to modernize its migration and labor management systems as government officials and stakeholders participate in a capacity building training on the newly introduced unified resident and work permit system. This move was aimed at improving efficiency, strengthening compliance, and enhancing national security through a fully integrated biometric platform. Edima Conte has more.
Government officials and technical partners have engaged in a staff capacity building session on the unified resident and work permit system, a reform aimed at transforming how Sierra Leone manages legal migration. The initiative introduces a secure, fully integrated biometric platform designed to replace fragmented, paper-based processes with a more efficient and accountable system. Implementing partner Contrast Systems says the reform is anchored on key pillars, including data integrity, faster processing, and strengthening national security through a reliable database.
A key pillar of this reform is decentralization. We're bringing services closer to people by establishing and operationalizing offices in Freetown, Lungay, including Freetown International Airport, Putloko, Makeni, Bo, Kenema, and Kono. These offices are being progressively equipped and staffed to ensure consistent nationwide service delivery. But systems and infrastructures alone will not deliver results. People will. And this is why you're here. Staff deployed across these locations are expected to uphold the highest standards. Professionalism in engagement, precision in data capture and verification, consistency in applying procedures, and responsiveness to all applicants.
Meanwhile, the Minister of Employment, Labour and Social Security warned that with the grace period now over, strict enforcement measures, including fines, will apply to non-nationals who fail to comply with the new permit requirement.
The fine requirements will be also changed. For work permits, it's $5,000 for defaulting on it. I mean, if you are here, you work illegally, you catch that person, the fine is $5,000 United States dollars. If you are an employer, you illegally employ somebody without documentation, you also pay $5,000. So this is a very high stake assignment. I mean, people must comply. We have left the place open for all these years. I mean, we're a country that is looking for private sector partnership. His Excellency President Bill has gone around the world telling people Sierra Leone is open for business. We have all the enablers. So once you come here, we want you to do business or whatever you do here within the ambit of the law. We say if you come into the country, you have to obtain due documentation. For example, you register with NCRA. From there, you get your resident permit. If you are working here, you get your work permit. Then you're free to go about your business. Anything short of that is an offense and is punishable.
The unified permit system is expected to enhance efficiency, strengthen compliance, and position Sierra Leone as a well-regulated destination for work and residence. Edima Conte, AYV News, Freetown.
According to UNICEF, thousands of girls in Sierra Leone remain affected by child marriage, with poverty and lack of education being among the key drivers. A high-level delegation from the UNICEF-UNFPA Global Program to End Child Marriage is currently in the country to engage stakeholders in Cambia and Koinadugu districts, which records some of the highest rates of child marriage in the country. This move is to accelerate efforts to end the practice, Issa Bangura reports.
In northern Sierra Leone, the districts of Cambia and Koinadugu continue to face serious challenges in the fight against child marriage. For many families, economic hardship and limited access to education are major factors driving the practice. The visiting delegation met with local leaders, parents, and young people to better understand the root causes and identify lasting solutions.
The steering committee here provides overall strategic oversight and direction for the global programme, ensuring alignment with global commitments, including the Sustainable Development Goal Target 5.3 on eliminating child marriage by 2030. The programme focuses on 12 countries with some of the highest rates of child marriage in the world, which includes Sierra Leone. At its core, the integrated programme works across sectors: child protection, social protection, education, health, to ensure girls can stay in school, stay healthy, and choose their own futures, free from pressure to marry too early.
The delegation emphasized that tackling child marriage will require stronger collaboration between governments, communities, and development partners, along with sustained investment in education and poverty reduction.
The progress is being made, but the situation is not perfect. So it takes time for change to be implemented and for change to be fully realized. We saw that the root causes of child marriage are very similar in one or the other. So we saw evidence of poverty, gender inequality, and so the root causes are similar in both: lack of access to education or lack of access to health services. Those challenges were there.
Government and non-governmental organizations are also intensifying awareness campaigns and enforcing laws that set the legal age of marriage at 18.
See, 2024, we had the Prohibition of Child Marriage Act, and as I speak, we have worked with the Law Officers Department. They have drafted the regulations for the Prohibition of Child Marriage Act. So all of this, we are trying to ensure that the next DHS or the mix, we are hoping that the statistics will further drop so that we see the progress that we are making whilst we do awareness raising.
Experts say lasting change will depend on continued education, community engagement, and support for families so that the future generations of girls can have the freedom to choose their own path. Issa Bangura, AYV News, Freetown.
In a move to tackle Sierra Leone's high maternal mortality rate, international NGO Goal Sierra Leone has launched a mentorship program for community health officers and midwives in Bombali and Cambia districts. The initiative was focused on building frontline capacity to deliver emergency obstetric and prenatal care. The goal is to ensure life-saving skills reach even the most remote communities. Abba Sisse has the details.
Midwives in Bombali and Cambia districts. Among the key activities of this program is to build the capacity of this cadre of health workers so they can not only cascade lessons learned during the mentorship, but also provide emergency obstetric and other prenatal services. Dr. Frances Fona was the lead facilitator.
We are training them or building their capacity to be able to provide emergency obstetric and newborn care services in the communities. But key So this program or this training is the mentorship aspect. And over the years, we've realized that mentorship has emerged as an innovative and evidence-based practice. So we are training peer mentors. At the end of this training, the MOP training, they are going back to their facilities, and various facilities will be allocated to them, and then they will be providing one-on-one mentorship for the other healthcare workers.
The objective of this mentorship program, according to Goal Sierra Leone, is to reduce maternal deaths in the country. Mohamed Sheku Toure is a district clinical supervisor in Bombali.
The percentage of maternal death is in the increase, and we want to reduce the maternal death. Of course, very recently in March, the government and Ministry of Health have also launched 000 with the aim to reduce maternal death and maternal and child death. And we as a health partner, we also want to reduce maternal death as part of our implementation.
Mariama in Bombali described the training as timely and educative.
It is very timely for us, very, very timely and very educative, and it's very important because we learn key things there for us in Bombali district. There is difference that I learned previous for now before, because for us in Bombali we have not yet started using the labor care guide to monitor labor. We are still using the pathograph because we have not yet been trained. For other districts they are doing it, but for us here in Bombali, this is my first time.
From Cambia, Bailo Suleiman Barry promised to roll out the lessons learned.
We do teamwork because I'm not the only one working at the facility. We have various cadres at the facility. If I get back at my facility, train my colleagues, I think our skills will be improved so that we can handle obstetric activities at our facilities.
Through this mentorship program, Goal Sierra Leone aims to strengthen the skills of community health officers and midwives in Bombali and Cambia districts. Abba Sisi, AYV News, Bombali districts.
The Christian Relief Service Series and Caritas McKinney have officially closed out the All Right initiative, concluding a multi-year effort to strengthen local development capacity in northern Sierra Leone. Implemented through the CRS Rights Fund project, the initiative was focused on building Caritas McKinney's organizational foundation to ensure a more sustainable, accountable, and high-quality service delivery. Augusta Etheltoe reports.
Christian Relief Service CRS and Caritas McKinney have officially closed out the All Right initiative. The CRS Rights Fund project was designed to strengthen the organizational functions of local partners, enabling them to deliver sustainable, accountable, and high-quality development services. The fund focused on building the internal capacity of Caritas McKinney, ensuring the institution operates with greater efficiency, professionalism, and resilience. This positions Caritas McKinney to better meet the growing demands of the development landscape in northern Sierra Leone. Hassan John Sapo Sapate, local leadership coordinator for CRS Sierra Leone, presided over the official handover ceremony.
We handed over the 4 investment areas of the All Right Fund to the leadership of Caritas McKinney. This handover is not like it's the end of CIS continued technical capacity strengthening or continuing community resources. We started strategic relationship long ago, and that will definitely continue. But for the purpose of the All Right, we are handing over these 4 policies to Caritas McKinney for your continued implementation and for institutional approach.
Reverend Father Benjamin Sisse, Director of Caritas Sierra Leone McKinney, expressed appreciation to CIS for the support received over the years.
The only strategic partner that was left with us was CIS. They believe in us. They stood with us at that trying time when we
came in and we started restructuring the organization. They accompanied us through. And today, if we are hearing and seeing all the achievements, I would say, on behalf of the Bishop, who is the chairman of the board of directors of Caritas McKinney Sierra Leone, myself and the entire staff, we want to extend our thanks and appreciation to the leadership of CRS, to the organization, for believing in us and accompanying us onto the streets.
The closeout marks the end of a significant chapter in the partnership between CIS and Caritas McKinney. Augusta Ethel Touye, AYV Primetime News, McKinney.
The United Nations Development Programme has launched the Circular Innovation Clubs alongside a co-design workshop, marking a significant step toward youth empowerment and sustainable development in Sierra Leone. The program was launched at the Ahmed Tijan Kaba Hall in Kenema. Sam Alpha Lahai has more on the story.
This Circular Innovation Club initiative aims to engage over 1,000 young people across 4 universities with a focus on building sustainable entrepreneurial skills and preparing youth for emerging opportunities within the circular economy. According to the project details, the program is designed to equip participants with particular knowledge in sustainable business development while encouraging innovative solutions to local environmental challenges, particularly in the area of waste management.
The circular economy, by contrast, is regenerative. It emphasizes reducing waste, reusing materials, recycling resources, and redesigning systems to ensure sustainability. It's about turning what we once considered waste into opportunity.
These clubs, formed in the university, will provide a platform for students to regularly meet, share ideas, collaborate on projects, and support each other in developing environmentally friendly solutions. A major highlight of the initiative is the co-designed workshop, where students will take part in hands-on activities, including idea generation, prototype development, and feedback sessions.
For circular economic transition in Sierra Leone and Africa. So the project itself, by its name, you know that it is youth-centered and youth-focused.
The engagements will allow participants to refine their innovations with guidance from peers, mentors, and industry experts as the project targets the creation of 10 different job opportunities by 2030, contributing to economic growth while promoting environmental sustainability.
It's a very lousy convention, but all depends on the action, because you can launch such a project, but if you don't push it, then it will not benefit anyone.
This smartphone that we normally call as waste is no more a waste. There is now a method that they have implemented, which is recycling, that you can even use that of your phone, then you can recycle it so that you can use it for the next time.
The initiative stands as a bold step toward building a sustainable and innovative future for Sierra Leone, with youth at the center of national development. Samar Falai, AYV News, Kenema, Eastern Sierra Leone.
This is Primetime News on AYV Television and Radio. Stay tuned for more stories after the break.
Do you know you can transfer money, buy airtime, and pay all your utility bills in just a minute? You can have access to your account anytime, anywhere. Welcome to the world of fast and easy. GT Wall. With the GT Wall, you can transfer money from one GT Co account to another, pay utility bills, get account statements, get airtime, and check your balance. With GT Wall, you can buy Ether anytime, anywhere. You can go to App Store or Play Store on your iPhone and Android devices, download the app, and enjoy. GT Code. Wouldn't you run a bank with us?
free money. No sonko sonko.
Mutik. This one is for the bold ones. The people who shaped their world and the winners who still put in the work. Cheers to those who start great things. When you start, you're hard to stop. You raise your game and never back down because you're bold enough to make it. To you I say, never stop. Mutik, never stop starting.
Welcome back. I'm Alimati Judge and this is AYV's Primetime News. Thank you for joining us tonight. Let's take some more stories. As part of the activities to mark its 21st anniversary, the SCORES AAO Foundation of Werribee College has extended its outreach to mental health care. The group visited the Freetown Psychiatric Hospital, donating items and engaging with the staff while drawing attention to the realities faced at the country's main mental health facility. AYV's Mama Tommy has the details.
Marking over 2 decades of service, members of the foundation arrived at the hospital with supplies and a message of awareness. The facility, which has existed for more than 200 years, remains Sierra Leone's central psychiatric institution, receiving referrals from Connaught Hospital and other health centers across the country. Amos Simche Lansana, chairman for SCORES Foundation, sheds light on the importance of their visit.
We know that there's been more or less a drug epidemic and a mental health crisis within Sierra Leone. And us being alumni of a university and being members of a social body, we know the influences that could happen that could lead to young men and young women going astray and having mental health issues. Obviously the drug abuse and all the social issues that take place within the context of our country. And so we decided that part of our campaign that we've launched this year called the Mind Matters campaign, which is targeting mental health issues and finding a way to tackle drug abuse, was to come to the Sierra Leone Psychiatric Hospital, which is the government hospital that deals with mental health issues, to see how best we can donate and help and give back.
A tour of the hospital reveals several units for male, female, and children, each working to manage patients despite limited resources. During the visit, members also encountered a troubling situation in the children's ward, where an abandoned child was found, highlighting broader social and family challenges linked to mental health care.
They became unknown to we, then go.
Few men brought the child here and left here, and they have not returned since. Now she remains here with us. She is living with autism spectrum disorder and other physical challenges. We are calling on organizations and the public to support this child, especially with social care she needs.
We now administer medications, but in terms of social support, they need social support.
Though beds are available and services continue, the hospital largely depends on donations alongside government support to operate. The foundation's donation included essential items aimed at supporting both patients and staff, reinforcing the need for continued community involvement.
They come in, some in Taiwan,
Some patients come in referred and others come with their relatives. When they arrive, we register them for free of charge. Some don't even come with clothes, but we still take care of them and feed them 3 times a day at no cost. Since the passing of Dr. Nahim, we now rely mainly on government support and organizations like Partners in Health, as well as other groups like this foundation. So this kind of support is a step in the right direction for patients who come here with nothing.
Help for some patients, because some patients they can't naked.
For many, the visit was not just about giving, but about reminding the public that mental health requires attention, care, and sustained investment. The SCORES AO Foundation says it will continue to champion mental health awareness as part of its community engagement efforts. Maya Matomi, AYV News, Freetown.
Within January 1st to April 14th of this year, Sierra Leone has recorded 199 fire cases. The latest disaster at Bottom Oku in Wellington is one of the most severe this year, resulting in the destruction of over 30 houses and the loss of a 9-year-old girl. Our reporter Abubakar Siddiqui Jallo spoke with the head of Communications and Legal 1 for the National Fire Force and fired in this report.
There were over 30 houses burnt down completely. You know, these zinc houses and mud houses, they were completely burnt down.
This was the harsh reality for residents at Bottom Oku on Monday, the 13th of April, as fire got down their homes and properties. In just a few hours, a fast-moving fire turned the Busy fishing community into a landscape of ash. For many in this community, the flames didn't just take their homes, it took their peace of mind. The head of Communications and Legal 1 for the National Fire Force further reveals that 80% of fire incidents are caused by electrical appliances, while others stem from other causes like mishandling of flammable liquids.
The cause for majority of these fires has to do with electrical causes. This has to do with faulty electrification, overloading of electrical appliances, lack of maintenance, leaving appliances unattended. 80% of the fires recorded has to do with electrical fires. From January 1st to the 14th of April, we've recorded 199 fire incidents across the country.
To combat this, the National Fire Force is pushing for more than just new engines. They are pushing for a change in the law, the practicality of the Fire Safety Bill.
It will be of very much importance to our operations because now we'll not only be taking the reactive approach by just attending to fires, but this bill will make us become very, very much proactive because we'll now be telling people what to do, and when they fail to do what they should do, there will be the requisite law to force them to do the right thing.
While this new bill and recently acquired engines offer a glimmer of hope for the future of firefighting in Sierra Leone, the scars left behind in places like Waterloo Street and of recent in Bottom Oku are a painful reminder of the work that is still to be done. As investigations continue, the priority remains clear: preventing the next spark before it becomes a tragedy. Abubakar Siddiqui Jallo, AYV News, Freetown.
Well, that's all for Primetime News tonight. For more stories, do visit our website at www.ayvnews.com. If you have any comments on the news, please send us an email to info@ayvnews.com. I am Alimata Judge. Many thanks for watching and listening. Bye-bye.
You're watching AYV Television.
How to buy data with AfriMoney on my AfriCell app. Click on the AfriMoney icon and enter your PIN to sign in. Click on the...
Mina Abdul Razak Kamara. I live in Modia with my family. My wife and picking them and all our family members there, my brothers and small sisters there. I know what OFSP through one organization where they work. Before this time, they say we eat, they chest the bone, blah, blah, blah. But me, when I begin this thing in park, because I eat, regularly now they eat, I begin to see some kind of difference in my life. So myself, I really encourage family, they say they go inside, even if they go to school, at most time, they can boil in the morning, drink tea, so they put on a bowl and carry on to school. But they make a pap. Yeah, they make a kanya. They even make a for make bread. They mix it with flour for make bread. They make cake, donuts, then biscuits, cake there. Already I don't involve other families there where they are around me here. I got my friend we come on Koni Maka, we come to me, we meet at the ABC and we eat hey, go for lekan. You know as for grow. Very simple for grow, and you do well any side. At any time of the year, you plant them, it's good. Then they pick swell, then they pick season.
Mutik. This one is for the bold ones. The people who shape their world. And the winners who still put in the work. Cheers to those who start great things. When you start, you're hard to stop. You raise your game.
As mama, I always want waiting best for me picking them, especially when it comes out waiting them for eat and drink. Now this make I always they choose Sarah juice because they make come from with local food them and nutritious and it gets less sugar than the other drinks them. Not to me say so.
We lab test show say Sarah juice gets 50% less sugar than the other drinks them na the market.
Because we mama they know waiting best for we picking them, now you make we always they choose Sarah juice. Sarah juice and nutritious, it helps